would have thought that a new phrase would enter our vocabulary this year: social distancing, perhaps better described as spatial distancing.
What we are now moving to is an arrangement for gatherings of less than 100, is that there would be 4 square metres provided per person in an enclosed space, in a room.
Well, this is what 4 square metres looks like, so you'd better keep your distance. Social distancing measures are what the states mostly came out with over the weekend and this morning. But if you're perplexed about the disconnect between the states and the Commonwealth, it's understandable. We've seen documents which suggest there's an active debate going on amongst the experts. Some advisors are saying that the reason for the hockey stick surge in the last few days is because of imported cases. Well, if that's true, then they would argue the curve will bend downwards because of border controls. Experts on the other side suggest that's a brave assumption because governments have been too restrictive in their testing rules, which has allowed imported cases to spread the virus in the community. And that's because overseas data, particularly from the Diamond Princess cruise ship and South Korea, suggests a significant proportion of transmission comes from people who don't have symptoms. You see, at the moment, testing is only available to people with symptoms, and then only if they come in contact with someone who has COVID-19 or has come back from overseas. The other 2 categories are healthcare professionals with marked symptoms or people with unexplained pneumonia.
I do not think that we need to test asymptomatic people at this time. The guidelines have just changed for testing, which has incorporated quite a few more people who would be eligible for testing. So I think we also have to use our testing kits in a cost-effective manner, and the current guidelines for testing would be reasonable. But of course, as the outbreak changes, we might have to change our guidelines. So it's always an evolving area.
The critics say this focus on symptoms misses asymptomatic spreaders and young people with mild symptoms. This argument about community spread is critical. If we have spread in the community beyond imported cases, and there's evidence that we do, then the only thing that will flatten the curve in the absence of changed testing rules, aggressive contact tracing and strict quarantining is pretty extreme spatial distancing. The government's advisors don't believe that schools should be shut, whereas those on the other side argue for prudent and immediate action. And that's because whatever we do today won't have an effect for another 2 weeks. And at our current rate of doubling, that's scary. Particularly given one prediction is that ICU beds in New South Wales will be overwhelmed by April 10th. And there's already a shortage of personal protective equipment and masks. In general, PPE is only being given to ICU and emergency department staff. So if, for example, you're a cardiologist or a heart clinic nurse, good luck with that patient who's coughing and spluttering. But let's get back to young people. Based on overseas data, young people are a major source of new infections, especially the 20 to 29-year age group. The government, presumably based on the advice it's getting, says it's not picking up a high infection rate in kids. Well, tell that to the schools and teachers currently affected around the world. But equally, the advisors don't actually know the rates in young people because they're only testing symptomatic people who come forward. And every day of delay means more cases and more community spread, especially in young people. That's the argument for getting to schools now, not after the horse has bolted. Many are wondering if we know any more about the extent to which children can be infected with COVID-19.
All of the international data shows that it's very, very uncommon for children to get symptomatic disease. Let me also say again, we don't know whether children have a significant role in transmission.
We know from the original Chinese data that only 2% of the cases were children. A couple of other studies have come out. They haven't necessarily elaborated and answered the question on whether children can transmit infections to adults. But we do know from at least one of them that about 1 in 6 children are likely to have no symptoms. Some of them do get very unwell, but it's a much smaller proportion than in adults.
There are a lot of unknowns here. We haven't done specific testing of young people to know what proportion are infected with the COVID-19 virus. And because young people and kids aren't good at keeping their social distance, it's known with flu, for example, that they do become spreaders. The more young people flout these social distancing rules, the more the virus will spread, including into the most vulnerable group, the elderly. That's creating a lot of fear out there amongst older people who are asking, if I get it, is it a death sentence or can I survive? Well, the numbers have remained consistent. Well over 85% of elderly people do survive.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.